So welcome everyone to the Low Carb for Life as online Zoom coaching call. We're very excited today to have our first guest speaker, and it's Dr. Lize van Nieuwkoop. I hope I said that right. Is it Nieuwkoop?
Nieuwkoop, yes.
Okay.
Afrikaans, but
Yeah.
Nieuwkoop, if
So
all
Lize,
English people approach it
yeah,
that way.
people struggle with my surname as well.
Yeah.
Lize is a skilled general practitioner. She's working in Pretoria and she's a visionary in the realm of metabolic health. She's got a Bachelor of Medicine and Surgery from the University of Pretoria and ventured into private practice only to realize the limitations of conventional medicine on her healthcare and what she's able to offer her patients. This realization led her to specialize further and do some nutrition network training, where she developed a passion for utilizing nutrition to help combat chronic diseases. And Dr. van Nieuwkoop is dedicated to transforming lives through dietary management, moving beyond medication to offer holistic and sustainable health solutions. And it's just a pleasure and honor for me to have you here and to have connected with you quite recently, because I think our vision really aligns closely with each other in terms of serving clients through metabolic health, which is not always that accessible or talked about. And just sharing that knowledge with as many people as possible because we know the impact that it can have. So thank you so much for your time today. And we are really glad to have you here.
Oh, thank you for inviting me, Jen. Yes, I was also very happy and pleased and relieved to have found somebody, a low carb enthusiast that's also working in healthcare. You would find a lot of patients actually that are, I want to say, almost part of the cult, but not very healthcare and not a lot of healthcare practitioners. And that's just got to do with the way that we are trained and the way that Big Pharma definitely has a finger in the pie in terms of training and writing protocols and all of that jazz. So really to try and think holistically about a patient and approach a patient with chronic or acute illnesses, with essentially having their best interest and their best health in mind, not just in the next 2 weeks, but forever, for their entire life, is the whole point and the whole reason why we need to start thinking about metabolic health. Virtually all chronic illnesses have a metabolic either origin or have a very large metabolic sorry, just my kid here. Very large metabolic, let's say, thing. Just give me 1 second. I'm just gonna.
No problem. Yeah, so I think what Dr. Lize is saying is that all chronic diseases that we are faced with nowadays and the burden of disease that everyone deals with has got a metabolic underlying, there's a metabolic health problem underlying that is causing it. And I don't feel as an OT that I'm able to really treat clients appropriately without addressing this underlying metabolic health problem. That if it can be resolved, we can see much greater progress and improvements in function and activities of daily living and independence and cognitive performance, mood. So all the aspects that we would address as an OT are actually dealt with when we just deal with metabolic health. Unita, are you there? Oh, here comes Dr. Lize.
Sorry, I'm so sorry. One of my kids are sick, so I had to keep him home.
Okay, no problem.
So yes, what I wanted to say is there's either metabolic origin for chronic illnesses or definitely some sort of pathway, metabolic pathway that I want to say, if it's not the origin, it contributes to the patient's health, definitely. So you can look at chronic illnesses definitely from a lens of and a metabolic perspective and trying to implement metabolic therapy, albeit with diet or supplementation with general minerals and vitamins that we tend to be deficient in because of recent changes in our food and farming practices and all of those type of things. So you can definitely, with all chronic illnesses, go the metabolic route and try and treat the patient metabolic route. And it can be a first-line therapy. I think the biggest thing is you need to address and assess the patient's immediate risks. So, argument's sake, if a patient does have hypertension, high blood pressure, and it is extremely high, then they are obviously at risk of getting a cardiovascular event fairly soon, and you need to address that risk also soon. And unfortunately, with metabolic therapy, that might happen soonish in some people, where they start a ketogenic diet, and we can lower their blood pressure within 2 to 3 weeks. But actually, most people with chronic illnesses have had the illness for quite some time and has been metabolically ill for quite some time as well. And then it's a bit more difficult to get that swung around. So in those cases, definitely pharmaceuticals do play a role to mitigate risk in the meantime. But I think it's always important to tell the patient and agree that we want to try and get off of our chronic medications when it is safe to do so. Yeah, and nutrition and metabolic therapy for those type of things can be a very good tool to do that.
And I think that's where my link with you comes in and why I find it so important, because I don't have the ability to prescribe or deprescribe medications for clients. And if they want to come off certain medication, or for example, they've just been put on a hypertensive drug, when can we safely take that away? I think it's quite nice just to have someone like you that understands what we're achieving through metabolic changes and improving metabolic health, but then also helping with the decision making with the client to decide when will it be safe to start either reducing or deprescribing some of the medication.
Absolutely. I think, especially for people who want to apply metabolic therapy, there's been this culture where you are actually alone. I've had a lot of patients come visit me for metabolic consults, who's been told to stop doing what they're doing, that it's actually very detrimental to their health, and they just decide that they have never felt better, they've never been healthier, and they are just going to continue to do what they are doing, but constantly they must hear from healthcare practitioners that they are not doing the right thing. And I think that's a big thing, is where because they're not having any medical training, they kind of stop the medication and kind of, okay, let's try without it now, and they may not be at the appropriate space where they can safely come off of their medications. And it's also not a question of implementing basic changes in your diet and sticking to it and Bob's your uncle. There's a lot of things that come into play in terms of your metabolic health, stuff like stress, chronic stress, poor sleep. Those type of things have a major role in systemic inflammation, and those can actually also be the culprit as to why you actually struggle with depression, anxiety, or any other chronic illness. So even though nutrition is the cornerstone of metabolic therapy, we need to broaden our thinking pattern and try and find other possible reasons for you to be struggling with this ailment. So yes, coming back to the point, absolutely, our goal will always be to try and come off of chronic medications. But like I said, there's a lot of things that come into play, and you need to take into account before we can safely try and reduce medication.
Yeah. So in my practice, I definitely look at nutrition as the number one goal. Let's get that right. And usually with that,
Absolutely.
improved sleep comes, and more energy for exercise.
Absolutely.
And stress management. People just report that they can tolerate stress. I actually had a client this week who said she felt like her life was very stressful earlier this year, and now nothing's changed, but she's just not feeling as stressed and worried about it, and says actually maybe she was a bit depressed earlier and didn't realize it. So it's
Yes.
interesting how you can
Absolutely.
address the nutrition side and the others do kind of fall into place. But again, knowing that there are the different pillars and you've got to look at all of them. It's not just
Yes.
a one aspect.
Yeah, no, absolutely. So there are different pillars of health, but I completely agree with you. You know, sometimes if you kind of take a step back with a patient and you try and assess where their possible challenges may lie, it can be overwhelming. You know, especially if you have to make big changes everywhere. You know, and then it is a very good approach to say, okay, let's just focus on one thing that we know we can do good and go 100% commit to that for the next 3 months. And often what I find with patients are that if they start working on one pillar and they commit towards one pillar and trying to fix that, the others, they kind of do subtle work in the other pillars as well, because you're collectively working towards health. You know, so as soon as you start feeling better, you start having energy, your brain fog goes away, you start experiencing the health benefits of doing a major change, you are more committed and more motivated to kind of tackle the other problems that may be there. So definitely, I 100% agree with you. I think the big thing is we need to change patients' expectations in terms of health is not it's not a temporary thing, and it's not something you will be able to achieve in 2 weeks, and it's not something that we want you to have temporarily. You know, so it is something that we need to, as a team, work towards a collective goal of achieving health and vitality long term for you. And that looks different for everybody. You know, people have different challenges, they have different working schedules, they have different family circumstances, and you have to take all of those things into account to treat a patient holistically, to work on a plan that's sustainable for them long term.
And I think just recognizing that, you know, it's not going to change overnight, but it also didn't get there overnight. So it is a process of years, sometimes 10 or even 15 years of poor health. And sometimes you don't always realize it until you're in that moment of, you know, you've been diagnosed with hypertension, or
Sure.
you've got thyroid problems or whatever endocrine problems that you might have, or a brain disorder. So it didn't arrive overnight, and it's definitely not going to go away overnight. But yeah.
Absolutely. No, absolutely. And I think the latest research also in terms of Alzheimer's has proven that stage 1 asymptomatic dementia, Alzheimer's specifically, is already diagnosed or will be able to be diagnosed in a patient's 30s or 40s. And we think about dementia and Alzheimer's being a disease of the elderly, you know, but we know the strong connection that Alzheimer's have with metabolic dysfunction and chronic brain inflammation. And in some patients, they are able to actually trace those proteins associated with the development of Alzheimer's in as early as people between 30 and 40. So it really is something that 100% true that, you know, these type of chronic illnesses and does not creep up overnight. Yes, you do get your rare canary cases where somebody is extremely ill with some sort of an infectious disease which caused a pancreatitis, and because of that they are now a type 1 diabetic. But I must say this is less than 5% of cases, and when you get to the point where you're actually being diagnosed with high blood pressure or with pre-diabetes, the problem has actually been there for quite some time beforehand. It's just never been looked for, actually. So there is preventative medicine is not at its best currently. And preventative medicine is more focused on pharmaceuticals, obviously. So if you think about somebody having metabolic syndrome, the whole definition of metabolic syndrome was put into place to apply preventative medicine in those individuals. But funny enough, when we talk about protocols to prevent a cardiovascular disease in these patients, it's all pharmaceutical based. Yes, they would say go see a dietitian or do lifestyle intervention, but the information around that is just completely wrong. And you kind of realize that when you see patients and they just become more ill, more ill, more ill, despite following your advice or conventional advice, and then you need to kind of sit back and say, something's not right. We're not doing something. Something is not clicking. So yes, we definitely need to move our focus in preventative medicine towards lifestyle nutrition as the number one intervention, and also try to move our focus to really identify the patients in the early stages, because that's the easiest to turn around then.
Yeah. So what can you tell us a little bit more about the link between unstable blood sugars and maybe even pre-diabetes on brain inflammation and cognitive impairment later on in life?
Absolutely. Yes. So we can also have, I had a good discussion about this one time with a group as well, with slides and everything. So we can have a Alzheimer lecture as well. But so Alzheimer's, so dementia is a collective, like a group name basically, of cognitive impairment. And you obviously get different types of dementias. The most common type definitely being Alzheimer's disease. And Alzheimer's disease basically is insulin resistance of the brain. So what happens is there is some protein, they call it tau proteins, that accumulates inside of the brain and kind of sits around your neurons. And it makes the neurons less accessible, or it makes glucose less accessible to neurons. And glucose, if you are on a glycogen type of fuel source in your body, is the primary fuel source for the brain and all the other cells. So these proteins actually actually inhibit glucose from being taken up by the neurons, and the neurons can't fire. They cannot release the neurotransmitters as they should. So conventional medicine is actually trying to address the whole situation by increasing neurotransmitters. So they say, here's a lot of neurotransmitters, and let's just hope that the signal comes through. But it's actually backwards in terms of treating the disease itself, because with time, if this neuron is not able to use glucose as energy, it's going to die. And it does not have the capacity to replace itself fast enough. So that's actually why the brain physically starts shrinking. Okay, so it's not because the neuron does not have enough neurotransmitters. Okay,
so would you
what
describe
happens
it as
is
basically the neurons are starved of energy because there's a lot of glucose
absolutely,
available, but they're not able to
yes,
access that glucose
access
as
it,
an energy
absolutely,
source?
yes.
Okay.
So these proteins stop them from getting the adequate fuel source that they need, and they do not have enough fuel to function properly, and they die off. I wouldn't say that they die off sooner than they would originate in their normal lifespan, but every cell has its certain lifespan. And they need to replicate and kind of replace themselves before they die off. So all of these type of cell functions are impaired. And that's why essentially we start seeing brain matter shrinking in, and then also cognitive impairment coming with that. The beautiful thing about it is that your brain and all your other muscle and body cells are 100% able to use ketones as energy. So when you actually have this condition of insulin resistance of the brain, you can go on a very strict ketogenic diet and aim for your ketones to be very high, to have ample fuel for your brain, and in a lot of cases, the Alzheimer's or the cognitive impairment was reversed. on these type of interventions. And it's crazy. There's one patient who went through this. I want to say she's kind of patient X, as she was the first person going on a ketogenic diet for the treatment of a early onset Alzheimer's. She was 45 at that stage. And she said she would experience things improving. And as soon as she went to her grandson's birthday party and felt like a piece of cake, argument's sake, she had the piece of cake and she felt terrible instantly. Within 3 to 4 hours, she can actually experience her cognitive symptoms creeping back on her. And as soon as she went back to ketosis and having her ketones levels nice and high, she would have clarity again and she can function normally again. So it's actually so powerful. Nutrition and metabolic health is such a powerful tool to help people in a diagnosis that essentially was hopeless. We felt and we are hopeless against dementia. Like I said, the neurotransmitter drugs that they prescribe is essentially ineffective. So,
and even if they work a little bit in the short term, in the long term, they're going to wean off and you're not going to get the same effect with the same drug.
Absolutely. It's not going to make a difference anymore. It's not going to stop the progression of the disease. It doesn't do much for the patients in the long term. So we used to be extremely scared of the diagnosis of Alzheimer's, and I think we still need to be. But I think it's important to understand that you don't have to develop Alzheimer's. Even if your mom and dad, anybody had Alzheimer's, you can do something about it, and you can actually prevent getting Alzheimer's if you start doing the right things early enough. So advanced Alzheimer's and cognitive impairment, a ketogenic diet has not proven to reverse or improve the symptoms much. But this is really at the end stage of the disease. As soon as the first, Dr. Bredesen actually classifies it in 6 stages. So the first 4 stages is completely reversible. And he has reversed it in numbers and numbers of patients. It's just the data on it is, I don't want to say iffy. It's there. It's definitely there. It's proven. But it's difficult to launch a massive trial with people being on a ketogenic lifestyle, implementing different lifestyle changes, and then measuring the outcome compared to just giving a drug and measuring the outcome. It's difficult. Yeah.
So, I mean, I've been using it and following some neurologists that recommend ketogenic metabolic therapies for Parkinson's patients, and the dementia things as well. And I mean, he's starting to do the research, but it's on quite short and smaller trials. So we really just have to try and build up the numbers and case studies that we can show. I see Nita was asking something about the research. Oh, early onset. Okay, I've also got some information. Maybe Dr. Lize can share some. She's asking about the research on the info on regarding Alzheimer's disease. So I know Dr. Dale Bredesen is a pioneer in using ketogenic therapies in treating people with Alzheimer's disease. So there's a lot that we can share with you on that. Can I ask you a few questions?
Sure.
Okay, Mandy is one of the clients in our group. She lives in Northern Ireland, and I actually know somebody. She was asking if you know of any doctor like her in Northern Ireland or like you.
I don't. I think the easiest thing that we can try, we'll probably find somebody on the nutrition network. If there is somebody, I think that's the easiest way to try and find somebody on nutrition network. So if you hop on the nutrition network's website, there's a search engine where you can say, find a practitioner. And then it's going to list all of the people who've actually done some training. It's not to say that they are a doctor then, but if there is a doctor that's trained with the Nutrition Network, you'll probably find them there. Yeah.
Okay. I actually did my coach certification with a judo coach, and he's in Northern Ireland. Very, very, so he's not a medical doctor, but he's very passionate and knowledgeable about metabolic health. So I might just send her his number. And then she also wanted to know, we spoke a bit about blood pressure medication and when is it safe to do so? So how would you check to see if the blood pressure then goes too low? Would you start weaning it off? She's
Yes,
been on it for a
absolutely.
while already. Hers isn't new.
Yeah. So definitely, remember, blood pressure is all about average. Your heart is 100% able to deal with this. When you're completely stressed, your blood pressure shoots up 200 over 100. Your heart is able to deal with that. So blood pressure is all about averages. We really want you to be 80 to 90% controlled below the 135, 85 range. And if you're 90 to 80 to 90% controlled, on the medication, and you see a drop a bit further down, so we're going to roll towards the 120s, 125 ranges over 80. We can start playing around and it depends on your dosage. So I would first lower the dosage
Reduce it,
if
yeah.
you're on a high dosage. Then it also depends on the drug itself. So a lot of times, most of the times, people are actually on combination therapies. So then you can start playing around by taking away one of the active ingredients in the blood pressure tablet and see what it does. So I think in terms of medication, it's very important to understand that there's more than one risk factor for the cardiovascular disease. So yes, blood pressure is one, but what's your fasting insulin doing? Because if you have a raised fasting insulin, you have more systemic inflammation, which makes you more susceptible to cardiovascular things. So then ideally we would want tighter control of your blood pressure, so your aim for patients also differ in terms of how many risk factors they actually have. So yes, essentially we can start weaning off blood pressure as soon as you go below the 125, 80 readings chronically, but you really need to look at the broader picture and look at all of the patients, all of their cardiovascular risk
All the
factors, and then
markers.
decide, is this a safe range for her blood pressure to be? Okay, yes, we can start weaning off medication.
Thanks. And then Joe wants to know about diverticulitis. So he was recently diagnosed with diverticulitis. He's been compliant on quite a strict carnivore type diet with prolonged fasting and feeling a lot better. But he is anxious about his follow-up appointment with the surgeon, which is going to be in the end of next week. And I think he's concerned that the surgeon is going to want to do some operation or remove some of the colon and possibly that there might be cancer, although it hasn't been found yet. So he wants to know, can we win with metabolic therapy with this diagnosis?
In terms of diverticulitis and managing diverticulitis with metabolic therapy, well, I don't want to call it metabolic therapy as far as lifestyle adjustment and lifestyle management overall. You can definitely deal with diverticulitis in that sense. I think the bigger question is how severe it is. We get different stages of it, and you can reach a stage where I do feel like surgical intervention is warranted in terms of your long-term health. So I think it all depends on what the comorbidities are. So what's his other illnesses and what's his systemic inflammation like, and how far has this diverticulitis actually gone? At what stage is it? So obviously with the earlier stages, I want to say the easier it's going to be to apply lifestyle management and actually have the disease completely under control. And then the later stages, it does get a bit more complicated. At least with diverticulitis, it's not these inflammatory bowel diseases. You're more susceptible towards bowel issues and complications, obviously, but it's not like the Crohn's or the ulcerative colitis that essentially is an immune, chronic inflammatory condition of the bowel. So I think yes, you can definitely with lifestyle adjustment manage the disease. I think it depends on what the surgeon
And how
finds with the
severe?
colonoscopy and all of those type of
Yeah.
things. How far has it actually gone?
Okay. So, I mean,
Yeah,
that's something they're going to have to investigate anyway. He is
absolutely.
diabetic. He's on blood pressure medication. He's definitely got metabolic syndrome and has had it for a long time. So, I mean, he's only recently started making changes and is responding well, but I guess we'll just have to wait and see what his doctor says, and in terms of how he feels going forward.
Yes.
Yeah.
Yes, I think a big thing is, if you want to question, and a lot of doctors find this annoying, but if you need to question people, you need to don't just believe what your doctor is telling you. Investigate what they are saying. Investigate what your options are, and it's within your right to have a second opinion from another healthcare practitioner.
Mm.
You're not there to just take advice because it's a doctor telling you that. No, so I think doing your own investigation and finding a second opinion and all of that is really important. But having said that, you should have an open mind towards having basically not receiving the news that you wanted, if I can put it that way. So if one
Mm.
doctor tells you one thing and you go for a second opinion and the opinion is the same, then you need to be open towards it. I think you just need to allow yourself to have opinions from all over and then make a decision for your health. I think that's the most important thing is, we get so annoyed with people not wanting to be on chronic medication or not wanting to take these type of things, but essentially it's their life and it's their decision. And if they want to
Mm.
try something else, it's within their right to do so. It's just our job to give you the correct information to the best of our ability and try and lead you into the right direction, not to push you push you in the
Yeah.
right direction.
But I think it's also the patient's
So
responsibility to take responsibility for their health and not just to believe
absolutely.
blindly. A doctor says you need surgery. They're a surgeon. That is their job, and that's what they know how to do is to do surgery. They're not going to recommend a lifestyle change when they can operate. So patients
Absolutely,
also need
absolutely.
to, you mentioned question it and make a decision for themselves, but to take ownership of their health and not put it in someone else's hands and rely on
Absolutely.
pharmaceuticals and doctors to
Absolutely.
keep them
I
healthy.
think, I think we're at the point where lifestyle and metabolic therapy can fix a lot, but it can't fix everything.
Mm.
There are certain circumstances that I'll also definitely be in the boat where I was go have your surgery, get it fixed, because this
Mm.
is detrimental for your health in the long term. So I think it's a question of, yes, the surgeon will possibly always advise you towards surgery, but there are certain circumstances that you really do need it, where
Yeah.
where beyond any repair in terms of lifestyle management. But it's within your right to question it. Absolutely. And it's within your right to go get a second opinion and see really, is this unsalvageable in any other way except surgery? And if the answer is maybe, then you're within your right to also first try that. And you should have a doctor and surgeons and specialists that support it,
Mm.
who agree to say, I will continue monitoring your condition. I'll give you X amount of time to try and turn this around. We'll see, and then make a decision in 3 to 6 months' time. But like I said, that's really condition dependent and stage dependent of the condition. Certain conditions just progress to a point where lifestyle intervention is not going to do what it needs to get done to really give the patient's health back.
Mm.
And then you can definitely go for whatever procedures are being suggested to you. But I think, asking about lifestyle intervention and asking if it's an option is a good thing. And if you do not like the answer that you are getting, you are more than entitled to go find a second opinion on that as well.
Mm. And then I think just the last question from me. So if someone they have made changes to their diet and they're consistent and they are being monitored, how often would you recommend that they see a doctor to monitor kind of progress on the ketogenic diet, or is it okay if they just continue on their own until they might need not a second opinion, but an investigation into something or
Sure.
maybe a follow-up?
Sure. So I think that's got a lot to do, obviously, with the patient's patient per patient. So, the ill patients on chronic medications, all of those type of things, they need to be monitored more often. So my sick patients, I would at least start monitoring every 3 months. As they start doing better, we'll do it twice a year. We would do lab investigations and all of that. And when they get to the point where I'm comfortable, they are comfortable, then we would say at least once a year. I think ideally it is a good idea to have your basic bloods done once a year, do cardiovascular risk assessments and all of those type of things, because you might think that you are healthy, but there could possibly be something lurking in the background, and it's simple things. You might be doing a ketogenic low carb diet but have a allergy towards cow's milk protein, which causes chronic systemic inflammation, which essentially you're doing the right things. You are low carb, you are in ketosis, you're doing your best, but you are ingesting cow's milk protein that continues to flare up your bowel and can cause you health issues in the long term. So I think having those bloods and that general investigations done once a year is definitely a good idea. And then the sicker you are and the newer you are in terms of the low carb lifestyle, maybe more frequent
The
than
more
that.
checkups. And what would you consider as like in your basic blood test? What would you include in that?
So the basic blood test would definitely be all of your metabolic markers, which includes fasting insulin, fasting glucose, your uric acid levels, fasting lipogram, extremely important. And then we can, in terms of males, females, dive into the whole hormone situation, because when a lady is postmenopausal, she tends to be in a pro-inflammatory state as well. So we can go into the hormone profile as well, which I don't do for everybody, but for certain patients, it's definitely warranted. And then liver functions as well. A lot of times we can see B3, B6 deficiencies on liver. We can see fatty liver disease on some of the liver enzymes, not in everybody, but a lot of times we can see a slight raised ALT in people and GGT in people who have fatty liver disease, which is absolutely reversible with metabolic therapy. And HbA1c, which is your sugar average over 3 months. So there's a lot of things that we can do, but you do not need much if you want to get a general idea of a patient's metabolic health. If I do all of those things with a bit of high sensitivity CRP, which basically looks for low-grade systemic inflammation, we have a good idea what's going on overall, and we can try and take it from there. So, yeah.
Thank you. That was very comprehensive. I think Jonita just has one more question. Okay. So she's asking about, so she says, I don't know if you can see the chat. Jonita says part of her health journey included seeing many specialists this year, including cardiologists, endocrinologists, and a gynae. All of them has recommended that she use weight loss injections. Is it safe to use, for example, Manjaro whilst on the ketogenic eating program?
It's
Sorry, ladies.
usually these injections. No, it's okay. Usually these injections are mostly coupled with a like a calorie deficit type of diet, and not necessarily a ketogenic type of diet. So a lot of these injections does, if you take Ozempic, for instance, it controls your blood sugar. So the problem with it, when you couple it with a ketogenic diet, you're probably at risk of developing a low blood sugar. on these injections. So I think a big thing is the dosage at what you take it, and if you're actually having
That
enough
crossed my mind.
carbohydrates in your diet to avoid you having a low blood sugar. I'm not anti-injections weight loss in general. I am anti weight loss injections if you have not done keto, if you haven't done the keto properly before. So if you tried a ketogenic diet for a good few months, you're not getting any results, your fasting insulin stays high, I do think there's a place for us to give injections, okay, for a certain amount of period and time. But I would definitely not recommend going on the injection as a first line. I would say do your ketogenic therapy first, see what we can change in your general health first, in terms of quality of sleep, cortisol levels, your physical activity, all of those type of things. Let's give it a good go and try to get you into ketosis without needing anything major in terms of pharmaceuticals. And if you've done that for a good 3 to 6 months and you've not gone into ketosis, you've not lost your weight, then definitely I would start thinking about temporarily giving you something to help weight loss. I think the big thing is also it needs to be temporary. Okay, so a lot of these injections,
yes.
they cause lean body mass loss, like 40% of the weight that you lose is actually muscle and bone. So it really is just a question of boosting your body's insulin sensitivity so that you can kind of take it from there with a ketogenic therapy and lose the rest of your weight in a responsible long-term fashion. I think it depends on what you've done.
Would it work in low
before.
doses if you did, say you used it in very low doses just to help manage cravings and, the kind of food noise, and not that you need to eat all the time, but in conjunction with the ketogenic diet? I mean, would you recommend that? Or would you say rather first try the keto diet on its own and then bring it in?
So I would still try the ketogenic diet on its own. I think if you are young, you will probably be very receptive towards a ketogenic diet. And
I'm 41.
I don't think
That's still young,
I would classify as one as young. Okay,
you never know what's young and young.
You might be very receptive towards a ketogenic diet, and I don't want you to kind of achieve success with the injection and feel that it's the injection where you might have managed without it. You get what I'm saying?
Yeah.
A lot of things is like you can form this dependency, and I think that's what's wrong with the whole weight loss and chronic illness type of thing is people want a quick fix. You want a quick fix. You want to say, don't change much about your diet. Just take this injection. You're going to lose all the weight that you want. You're gonna become insulin sensitive again. And in a certain sense, that's true. You just take the injection. But it changes again. The patient does not take responsibility for their health. They kind of put it into this new wonder drug. And I always ask them, what's your plan afterwards? So we can definitely use it in a low dose if you check what your blood sugars are doing. Okay, so the danger is always that you're going to experience a low blood sugar if you do a ketogenic diet properly. So if you monitor your blood sugars, then you can go on a low dose of it. But I would honestly recommend just knocking out the ketogenic diet first. Make sure that you have good sleep, just have your physical activity every now and then. You don't have to go haywire. The simple answer with that is the exercise that you're going to keep doing is the exercise you need to do. People always ask me, how much do I need to do? I'm like, listen, doesn't help me asking you to go to CrossFit for 5 times a week and you're not going to do it. If walking is what you're going to stick to, do that. Commit towards that. And as you start losing weight and you feel better, then you're going to start having more energy for other things as well. Okay. So I wouldn't
I think
say, injections aren't off the table, but I would say go 100% for the ketogenic therapy first. And then when you struggle, we see what we
thank
can
you very
do.
much for that feedback. I think I had Jennifer up in arms with that one a bit, because I mean they've said it now for me like over the last 6 to 7 months, and I just like I'm not buying it yet. And I have discussed it with my GP actually, and he sort of have the same outlook that you have. And as being an OT as myself, I also was like, I don't just want to do this stuff because I feel there's some side effects that I really don't want to navigate, if it makes sense.
Absolutely.
Yeah.
Absolutely. Yeah. No, these drugs have has horrible possible side effects. I think that's the challenge also is the list of side effects are yay high or yay much, and I can't tell you which one you're going to experience and which one. There's people that have a ball on Ozempic and they don't have any side effects and they're losing weight and they're like, this is the life, But then there's other people who really just feel terrible on the injections.
No, I hear you.
But I think the big thing is, again, you're going to use these injections for 6 months. You're going to lose 60 kilograms. You're going to feel great. You're going to look great. And then, like, what's your plan afterwards? How are you going to sustain this? Because essentially, if you have a problem now, you're going to have it in 10 years' time again if you don't do something fundamentally different in your everyday lifestyle. And that's and that's where the patient expectations need to turn around. I'm not gonna lose 60 kilograms in 2 weeks on a ketogenic diet. I'm not gonna do that. But if your goal is long-term health and your goal is to lose weight and never see it again, then doing a basic lifestyle change in terms of a ketogenic diet is a very good thing. Okay. So I would say,
thank you.
Yeah, just switch around expectations and be like, I want to lose weight in a sustainable, healthy way. When I lose 500 grams, I'm never seeing it again. And I'm not suffering. I'm not hungry. I'm not giving into sugar cravings. I'm a sugar addict, maybe, and I'm winning this, And I think that's something that injections can't do.
Not going to fix.
Those things.
It's
and
not
I think you need to. The other thing
is
is those specialist doctors. They don't have many tools in their toolbox, So they are going to recommend quick fixes and pills because they don't have the time to talk to you about diets. They don't have the 12 weeks of discussions every week to see how it's going. And for them, your goal is to lose weight, and they can give you that by giving the drug, but they're also not concerned about your future health. So
and obviously it's not just my goal to lose weight, it's their goal also, just like you need to lose the weight for X, Y, and Z. I understand that. The question is how to get there.
Absolutely. I think it's also the world of medicine is so broad. To expect a specialist to have an interest in nutrition and lifestyle outside of their specialty is there are obviously people who do that. If you look at all the low-carb surgeons and cardiologists over in America there, but it's not something that's very prevalent because you need to be able to sit with patients 45 minutes to an hour and
that's where allied health comes in. That's where allied health come in.
Exactly. So it's not a question of, I don't think, a lot of doctors obviously have your best health or your best interest at heart in terms of your health long term. It's just we are not able to know all the different avenues to achieve that.
I understand you.
And I think that's the biggest thing is when you find somebody who is willing to walk with you into a long journey in terms of 2-3 years to get you to optimal health and help you and guide you and all of those type of things. It's way different than a surgeon or a gynecologist who likes to do a hysterectomy and send you on his way. No? So, so it is it is much different, and our training is also much different. So I think it also has to do with finding somebody who has a passion and an interest in the field to help you on this journey.
Thank you. I
because it's a
appreciate
difficult
that.
journey and you're going to have challenges. You're going to lose 5 kilograms and then you're going to stall and then you're not going to know what's happening. And it's a difficult journey. Nobody said it's easy. So you need somebody with patience and also the passion for the way that you are trying to do this to kind of help you through the difficult times. But it's possible. We're out there. Few and far in between, but we are out there.
But you want to ask your last question, Anita? You might as well just ask it.
Say again, Jennifer?
Did you want to ask your last question? I see you typed up another one in the chat.
Oh, it was just sort of like a add-on question of what you guys were saying earlier on about the cow's milk protein allergies and stuff. So I was just wondering about, obviously you were talking about adults, but my son has got cow's milk protein and eggs allergy. So how do you navigate that sort of, from a normal diet versus the metabolic one in children, as if it makes sense?
Yes,
And
I
if
think
it's it's allowed, do you have children as well? You know what I'm saying?
Yes.
Yeah.
Yeah, so it is definitely more difficult because with children having a cow's milk, okay, most people actually have some sort of sensitivity towards cow's milk, interestingly enough.
Mm-hmm.
So the testing that I've done on patients, most of them actually do come somewhat sensitive for cow's milk protein, which can cause systemic inflammation. I think what further complicates the problem in kids is their need for calcium, because you kind of store calcium inside of your bones up until a certain point. I'm not too sure what that point is in boys, but for girls it's definitely up until the age of 24, 25, and then you actually can't store, you don't have the capacity to store calcium in your bones again. You can't do it. So from there on out, it's about managing your calcium levels in your blood so that that it's not being extracted from your bone, basically. So for kids, it's definitely more challenging because you're going to have to supplement his calcium vigorously if he's not able to have any dairy. But if we talk about other nutrient factors that dairy brings to the table, obviously it's fats, which you can replace with other fats, okay, other saturated fats, and it's going to do exactly the same thing. And then you do have some few other minerals in cow's milk protein, but again, it's in other foodstuffs as well. So I think the biggest challenge is calcium. You just need to make sure you can completely take dairy out of his diet to avoid the inflammation. And then also just make sure that he gets his recommended doses of calcium every day. But having said that, from an allergy perspective, the allergy doctors do recommend that you introduce the allergen every now and then, because kids tend to outgrow these things, where he's
So we
extremely
have
allergic.
introduced the cow's milk.
Yes, every now and then
So we have
introduce the
introduced
allergen.
that
It's like
one,
this,
and that
yeah.
one we could have managed, but the egg we
Yes.
haven't been successful yet.
You haven't been
on that
successful to
one, yeah.
introduce it. Egg is a doozy.
No, we have to introduce it. We
because
tried, but it wasn't successful.
it wasn't
And we
good.
tried now. Yes, and we tried again now, but I don't think we've been successful. So
Yeah,
yeah,
it's been
because
successful.
all those
I'm gonna have to
low-grade
I'm
stuff is
yeah.
back. The symptoms.
I think what I need to do is, in terms of cow's milk protein, you do get these hydrolyzed cow's milk proteins that makes it easier to digest, especially specific for the allergy type of, kids. I'm not too sure if there are similar things on the market for partially hydrolyzed or partially broken down egg proteins. I'm not too sure.
I haven't seen those yet.
I'm gonna have to go read up on it.
Thank you.
So basically eggs, again, it's 50% fat, 50% protein, which is a great source
I
of
know.
minerals and vitamins and all of that. So that really is a bummer. I would definitely not give up on egg. So I would say,
Would you try the egg
I hear
yolk?
you.
Try the egg
Sorry?
yolk. Would you try egg
Yes,
yolk and then avoiding the egg
separately.
white? I don't know if you've tried that.
Absolutely. Yes. So it's completely two different proteins. So you can have an egg
Yeah.
white allergy without having the egg yolk allergy.
If I remember
So
correctly, we
definitely,
tested both of them, and
yeah,
unfortunately, from the blood
both
test,
of them.
it's the egg.
Oh my
Oh, is
goodness.
it?
Yeah.
No, goodness, I don't know. Then I'm gonna have to. I'm just gonna have to go see if we have some partially hydrolyzed eggs somewhere. But I
Yeah, and
would,
I was just
as
wondering
we,
about that, but yeah,
yeah,
I'm
I would
seeing the allergist
definitely,
in at the end of
yeah,
the month, but I was just wondering from a
yes.
nutrition point of view, what can I do as a mom to navigate this and to change stuff and make sure that that he gets his stuff and have a good lunchbox and stuff like that, and
Yes.
don't want to eat chocolates and chips and
No,
pasta,
definitely not. No,
because
definitely
that
not. I
is
think
something I
a big
noticed.
thing is you just need to think out of the box, because yes, cheese is very easy. Easy, oh yeah, think out of the box, so to speak. But cheese is very easy to throw in the lunchbox, okay? But you can have, argument's sake, you can have biltong, you can have droewors, you can
I
have
do.
lettuce wraps with tuna and mayonnaise and those type of low carb mayonnaise, which doesn't have any dairy in there. I know
Yeah, yeah.
mayonnaise
I'm
sometimes have
familiar
egg
with
in
them.
there. Although the Cross and Blackwell, I don't think have egg in there. So you
No,
can
You can
maybe,
get the
only
Woolworths do a vegan mayo as well, so that doesn't have egg in
so
it.
yes,
that's a new
so
one, yeah. That's one's new.
yes,
So
yes,
yeah, it wasn't
definitely.
always on the
So
market. The
yeah,
other one is
so it's
canola, I
just,
think, yeah.
and
Be
sometimes,
well, yeah.
you can give him the same thing, but just dress it up differently, Like
That's a good
people would
idea.
ask me, do I need to have eggs and bacon every morning? I'm like, no, have eggs and bacon the one morning, and then the next morning make a frittata. You're still having eggs, having a bit of
You just have a
spinach in
different
there
way,
as
yeah.
well, a bit of feta cheese, but you're still low carb. You feel like you're having something completely different, and you just had to think out of the box a bit. So it's the same thing for you.
Thank you.
If you're using tuna and mayonnaise for something, you can put it inside a piece of ham in a muffin pan, if you get what I'm saying, and bake that through.
I'm
And
with
it's
you,
like
yeah.
this. You get what I'm saying? So
Yeah.
sometimes you just really need to go be creative, physically go sit there and I'm
Think,
going to think
yeah,
of recipe
I'm with
ideas.
you.
Yeah.
I will have a look and think a little bit
And
about
we
that.
can
But
also
thank you so
brainstorm
much.
that, Junita, because there are quite a lot of websites and blogs and it's especially about diets and nutrition with kids that have got various different tolerances and allergies. And so we can look at
Yeah,
some of those and get
we
ideas
can have a look, yeah.
and brainstorm. But thank
Thank
you for
you.
joining us today. I'd say I've kept you a bit longer than I intended to, Lize. Sorry.
It's okay.
That's all right.
But we
Thank
I'm at
finished
you.
the
home with my
hour.
sick kid, so it's fine.
Okay.
Uh,
That was really wonderful. Thanks so much, and thanks for your insights. And I think maybe going forward we can plan like an actual topic or a condition, and then
Absolutely.
discuss that going forward. And you can bring a little slideshow or something if you have one.
Yes. Yes,
And
yes.
then some people that couldn't make it to this live session did send their questions. So I'm going to send them the link, and they'll be able to go and find it and hear your
Awesome.
answers. But thank you so much for your time. We really
Perfect.
appreciate it. And Unita, thank you for joining and for your questions. And I hope that you found it valuable.
Yes, thank you for having me. Looking forward to next time.
Thank you so much. Bye.
Have a good day. Bye.
Did who's still on? Oh, she's gone.
Yeah.
I
Sorry
thought
for
you might
that
want.
start. Oh my goodness.
No, don't worry.
I told my